Hey guys, my name is Erin Fry, and I am a school based speech language pathologist in Russell, Kentucky. I work for Russell Independent Schools. I've been there for the last 3 years. I also do a lot of PRN work with different nursing homes in the area. And in the summers and around the holidays, I also am a subcontractor with Lingual Care. So I work at St. Mary's inpatient in the summer, and like I said, around the holidays, just as needed. I also am a clinical adjunct professor at Marshall, so I supervise grad students there as well. And I've been doing that for about a year, and I really love that. I know that you guys typically have a panel come in and just discuss different placements that you guys will be doing. But with the craziness going on around us, Mrs. Clemens asked me to film a video for you guys just to kind of explain what a day in the life with Erin Fry at Russell Independent would be like, and just how your experience would look at Russell. So, like I said, I've been there for 3 years. I always start this conversation off just with a little bit of background about me. I got my undergrad, my bachelor's degree at the University of Cincinnati, and then I came back home. I'm from this area and got my master's at Marshall. Once I graduated from there, I knew that I loved working with kids. But then I also was obsessed with the medical side of it. Um, I was very adamant that I was not working in the schools. I come from a family of a lot of educators, and I wanted to do something different. And so I was very adamant that that's not what I was going to do. But I wasn't really sure what I wanted to do. So I actually went to Knoxville, Tennessee to do my CFY, and I worked for a private practice there. And we serviced different schools in the area. We also did home health and then birth to three. And then we also had patients in the clinic as well. So I kind of did a variety of everything. So after my CFY year there, I actually got engaged. So I came back home and worked for an outpatient clinic in Huntington. And it was a pediatric outpatient clinic, and it was just a variety of disorders. Like, it was everything you could think of, things that I had never even heard of before. So it was definitely a learning experience. I feel like I learned a lot that year, but I still wasn't sold that that was the setting that I wanted to be in. And it just so happened that a opening at Russell came about, and I'm from this area, grew up in Ashland, so I knew obviously a lot about Russell Independent, and they had a really good reputation. So I thought, why not? I've tried every other setting, let's just go for it. So I applied and obviously got the job, and I've been there ever since. So, like I said, it's probably a surprise to some people that I ended up in the schools, just because I always said, it's not for me, it's not for me, even though I had a wonderful placement. I loved Jennifer Taylor at West Hayes Elementary. She was amazing. I just wasn't sure that it was for me. But having been there for the last 3 years, I don't see myself going anywhere else. I absolutely love it. Um, so my schedule is maybe a little bit different than what you would think of for the schools. I know when we think of the schools, we think of a lot of articulation and language, and of course our special populations. But I work for a wonderful director of special ed. I'm not brown nosing. She knows I love her so much, but she really focuses on just great treatment for our kids. She allows us to make our schedules however we think. She's not really big on like pushing us to see 70 kids on our caseload at a time. She really wants to make sure that the kids are getting what they need. So my caseload, what I basically specialize in is I do preschool through second grade primarily, and I focus on the special population. So I have a lot of the syndromes, a lot of the developmental delays, and of course, autism is a very big bulk of my caseload. A lot of my preschoolers as well are either late talkers, language delay, again, syndromes, autism, you name it. I also do have some phonology kids in there and articulation as well, but the main bread and butter of my caseload is special populations. A lot of nonverbal kids, a lot of pre-AAC kids, so we're trying to work on communication systems with them. A lot of play-based therapy, honestly, and just it's a very big mix. It honestly is. So that's why I love it so much. Um, So basically, I see kids from about 9 in the morning until about 2:30 in the afternoon. A lot of my therapy sessions are actually individual therapy, they're not group. And that's again attributed back to my director of special ed, who has made sure that we are able to provide the therapy that we need to for our kids. So if we think a child needs twice a week individually, then that child gets twice a week individually. Or even if they're a severe apraxia kid, we can do 5 sessions for 15 minutes a week. That's recommended for a lot of our kids, or multiple times a week for articulation. It's really based on what that child needs, and that's why I love Russell so much. So like I said, a lot of my sessions are individual, so my schedule honestly reminds me a lot of my outpatient days. Um, in those times that maybe a child's absent or a child is on a field trip or what have you, I use that time to plan and prepare, or I use that time to do IEP paperwork, which a common misconception in the schools, for me at least, and I'm sure there might be other SLPs that are watching this right now and think I'm crazy, but I don't think the paperwork in the schools is really that bad, but I'm kind of a weirdo and I enjoy paperwork. I enjoy writing reports. I enjoy I don't know, I like those monotonous tasks a little bit. So I don't feel like it's that bad. I actually kind of like it. It's easy and quick. Not to say that there aren't times, especially in the fall, when our referrals are really very heavy, that I'm, going insane. But for the most part, it's really not that bad at all. But yeah, that's pretty much a day with me. Um, I really hope that for any student that comes to Russell, I really hope that you guys have a great experience. I feel like the last several students I've had have come out of it loving it. And my main goal for you guys is really to just get a different viewpoint of maybe what you thought about the schools. There's a lot of misconceptions. And yeah, of course, we have articulation kids. And if that's not for you, totally get it. It's not really my cup of tea either, but we kind of have to wear a lot of different hats as an SLP. Or maybe you think it's just, language, or, you're bombarded with kids and stuff like that, which is true in some districts. But I just hope that by coming to Russell, you can see like just a different side of it and maybe get just a really good experience in the schools. Like I said, I was very fortunate to have Jennifer Taylor, and I really had a great experience there. So yeah, if you guys have any questions or concerns or anything, please let me know. Other than that, I hope you guys are staying safe and doing well at home, and I'll see you guys soon. Thanks.